Dear students, myself Dr. Arvind Kumar Das, Assistant Professor, Department of Veterinary Medicine, Bihar Veterinary College, Patna. Today we will talk about the mineral deficiency syndrome. This will deal us about the impact of different minerals deficiency on animals and its productions. At least 15 essential macro and micro minerals which are influencing the normal body physiology and productions of the animals. In segment of macro minerals, calcium, phosphorus, potassium, sodium, magnesium, chlorine, sulfur are the macro minerals which deficiency causes severe deficiency syndrome and death may occur in severe conditions. There are also some micro minerals or trace elements such as copper, selenium, zinc, cobalt, iron, iodine, manganese, and molybdenum. These trace elements are component of many tissues and enzymatic activities, and deficiency of these elements led to various adverse effects on body physiology and led to pathogenesis and clinical signs of disease deficiency syndromes. Predisposing factors, there are many predisposing factors of mineral deficiency such as diet. The assessment of diet can disclose the level of particular minerals, and with supplementations of that minerals can prevent the disease prior to the occurrence. Another factors is soil types. With the study of soil types may predict the mineral deficiency, and preventive measures can be adopted before the and after the occurrence of the disease of the deficiency. Disease of plants indicates about the specific soils deficiency. Example, reclamation disease of oats indicates about the copper deficiency. Heavy applications of nitrogenous fertilizer is also an important factor. It reduces copper, cobalt, molybdenum, and manganese level in plants and consequently in animals also. Heavy applications of lime reduce copper, cobalt, manganese, but increase molybdenum level in plants. Abnormal absorptions of phosphate reduces the calcium absorptions. Similarly, increased absorptions of calcium decreases the iodine absorptions. Chronic enteritis leads to decrease in absorptions of dietary essentials. Abnormal utilizations of ingested nutrients has great impact. Example, use of molybdenum and sulfate reduces the absorptions and storage of copper. Thiamine decreases the dietary requirement of essential fatty acids. So these are the factors which are affecting the absorptions and utilizations of the minerals. Now we will talk about the iron deficiency. It is a question, what is the etiology of iron deficiency and why it is mostly occurs in newborns? Due to lack of iron and its precursor in milk, mostly newborns are going to be affected with iron deficiency. Iron level of liver decreases leads to difficult hematopoiesis in more than 2 to 3 weeks of the age. In piglets, iron deficiency causes anemia and animal failure to thrive. Not common in farm animals, mostly piglets are susceptible. If there is continued blood loss, then subclinical anemia with iron deficiency may occur. Cattle with chronic tick infestations led to non-regenerative anemia with subnormal serum iron. Horse with strongyloids infections suffered with subnormal hemoglobin level due to sucking of bloods. Calves reared on only on milk having iron deficiency, but whenever it starts roughage eating, iron level is rectified. In piglets, when piglet grows in indoors conditions, iron deficiency may occur because they have less chance to take iron from concrete floor. And black piglets are suffered much more as compared to white ones. Piglets at birth having 9 to 11 gram per deciliter hemoglobin, but on physiological pulse it reaches up to 4 to 5 gram per deciliter at 8 to 10th days of their life. Uh, if iron is given sufficiently, hemoglobin is starting to return to the normal from 10th day, otherwise develop anemia due to fast growth. Pathogenesis of iron deficiency can be understood by the following flow chart. Piglet at birth have hemoglobin level about 9 to 11 gram per deciliters, and when there is the physiological pulse, it will reach up to 4 to 5 5 gram per deciliters. Uh, it occurs at about 8 to 10th days of their life, and macrocytic hypochromic anemia may be possible in these conditions, and further it led to anemia, anoxia, and finally death may occur due to this condition. Clinical signs of iron deficiency exhibited with decreased food intake, diarrhea with normal color, severe dyspnea, lethargy, and exercise intolerance. Skin and mucous membranes pale and often quite yellow in white pigs. Edema of head and forequarters led to the fat puffed up appearance, and they die quickly. A lean, white, hairy look, thin and untherapeutic conditions, sudden death or recovery, high incidence of infectious disease, especially infections of E. coli, streptococcus are associated with iron deficiency. During normal condition in pigs and cats, the postnatal pulse of hemoglobin is 8 gram per deciliter. This is a physiological pulse. Sometimes it falls up to 4 to 5 gram per deciliter in first 10 days of life. In deficient animals recorded 2 to 4 gram per deciliter during third week. When the level reached up to 4 gram per deciliter of the hemoglobin, the clinical signs may appear. Blood pictures reveals decreased RBC up to 3 to 4 millions per microliter with macrocytic hypochromic anemia. Post-mortem examination reveals about the paler and thin watery blood, moderate anasarca, dilated heart, and liver found enlarged, mottled appearance, and having fatty infiltration inside their hepatocytes. During diagnosis, clinical examination and hematological examination determining the anemia and its severity. Differential diagnosis should be carried out with copper deficiency, which is also causing anemia. It should be also differentiated with isoimmunizations, hemolytic anemia, which is causing hemoglobinuria and jaundice in young pigs. Protozoan parasites infections should be differentiated. Erythrogenosis is also a major problem which can be differentiated with iron deficiency. It affects all age groups. Severe infections caused by the bacteria of the genus Erythrogenes, especially in young pigs, accompanied by anemia, jaundice, and often fatal condition appears due to these infections. Treatment and control. Cattle oral iron sulfate or gluconate can be given to the cattle at the rate of 2 to 4 grams daily for 2 weeks. As iron is unpalatable, it should be mixed with feed or molasses as liquid. In horse, dose should be 0.5 to 1 gram elemental iron in 1 injection per week. But individual idiosyncratic reactions are common in these conditions, hence precautions are advisable. Organic iron preparations like iron dextran is given to the horse. Iron sorbitol acid complex like iron saccharase or gluconate also can be used. Injection of vitamin B12 at the rate of 5,000 microgram per week as single dose can be given. As only baby piglets are mostly affected, sows are not. Hence, for the prevention of iron deficiency, piglets should be allowed to suckle the access to the pasture or dirt yard. Oral dosing should be at the rate of 4 ml of 1.8% solutions of ferrous sulfates daily or iron pyrophosphate 300 milligram per day for 7 days. The oral therapy is essential within 12 hours of birth. If there is reduced iron, 0.5 to 1 gram once weekly should be given. For the prevention of iron deficiency in piglet, following iron pants should be prepared and apply on the mammary glands of the baby for the baby piglets to suckle. The mixture will contain ferrous sulfate 45 gram, copper sulfate 75 gram, sugar 45 gram, and water 2 liters. But it should be noted that the excess oral iron will cause diarrhea. A spray of the iron can be used at the rate of 9 gram for every 50 pounds of the soils and also to be thrown it in the pen. Copper sulfate at the rate of 0.5 grams should be supplemented. Injections of iron dextrans should be given on the age of 3rd and 7th day through intramuscular route. Iron fumarate and glutamate can also be used for this purpose. So thank you to all of you. We will meet in another class.